Assalamu alaikum. Today we are going to discuss Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disease caused by the death or degeneration of the dopamine producing cells in the pars compacta of the substantia nigra. It is the most common and the most severe neurodegenerative disease, and it is also very important from the exam point of view. So in order to understand the Parkinson's disease better, we will first have to look into the direct and the indirect movement pathways of the basal ganglia. So let's start. Okay, so we know that the motor cortex, it creates a plan for the movements, and then that plan is sent to the cortex to the basal ganglia, and the basal ganglia in turn, they help the motor cortex in initiating and executing the smooth movements. So the signals are sent to the basal ganglia, and then to the basal ganglia to the thalamus. Okay, and to the thalamus they go back to our cortex, and the cortex then sends those signals to the muscles, to the spinal cord, and that's how the voluntary movements they are carried out. So there are two pathways of the basal ganglia. One is direct and another is direct. The direct pathway, it is excitatory, okay, and the indirect pathway is inhibitory. So let's see the direct pathway first. Okay, the direct pathway, it goes from the cortex to the corpus striatum, or putamen, you can call it putamen or corpus striatum, because you know that corpus striatum includes putamen and the caudate nucleus. So mainly the putamen is involved. So through the cortex to the putamen, and to the putamen to the globus pallidus internus, and through the globus pallidus internus to the thalamus, and then back to the cortex. So this is the thalamocorticospinal pathway. This is thalamocorticospinal pathway from the thalamus to cortex to the spinal cord. So this is direct pathway. It is excitatory, okay, and it is involved in helping the motor cortex in carrying out the voluntary movements. Now the indirect pathway, this is inhibitory. Okay, the indirect pathway is inhibitory, and it prevents the undesired movements from occurring. Okay, so it is going from the cortex to the corpus striatum, to the corpus striatum to the globus pallidus externus, and then to the subthalamic nucleus to the globus pallidus internus, and then to the same thalamocorticospinal pathway. This is indirect pathway. Now let's bring the dopamine into the picture. This is our substantia nigra, the pars compacta of the substantia nigra. It has dopaminergic neurons. So now the dopamine, it can act as an excitatory as well as an inhibitory neurotransmitter depending upon the types of receptors to which it binds. There are two types of receptors, D1 and D2. The D1 receptors, these are D1, they are excitatory, and the D2 receptors, they are inhibitory. So let's see what happens when the dopamine, it binds to an excitatory receptor. So when the dopamine, it will bind to an excitatory receptor, it will act as an excitatory neurotransmitter. So this dopamine is binding to the excitatory receptor, so it is exciting these GABAergic neurons in the putamen. The GABAergic neurons, we know that the GABA is an inhibitory neurotransmitter. When they are excited, they will exert their inhibitory influence on these GABAergic neurons, the globus pallidus internus. Okay, so they are inhibited, so they will not send their or exert their inhibitory influence on thalamus. So there will be the stimulation or excitation of the thalamus. Okay, there is stimulation. There is a stimulation of the thalamus, and that's how the direct pathway, it is helping the cortex in initiating the movements through the excitation of the thalamus. Now coming towards the indirect pathway, which prevents the cerebral cortex from undesired movements. Okay, dopamine is binding to the inhibitory receptors, acting as inhibitory neurotransmitter. It will inhibit these GABAergic neurons. GABA is an inhibitory neurotransmitter. It is inhibiting these GABAergic neurons, when they are inhibited, they will not exert their inhibitory influence on these GABAergic neurons in the globus pallidus externus. Consequently, okay, they will not exert their inhibitory influence. So, they will send their inhibitory signals to this subthalamic nucleus. Okay, sending their inhibitory effect on the exerting their inhibitory effect on subthalamic nucleus. So there is inhibition of subthalamic nucleus. Subthalamic nucleus, it has these glutaminergic neurons. Glutamate is an excitatory neurotransmitter. So its inhibition, glutamate, it will not be released. Okay, so they cannot now exert their excitatory. This is excitatory, but subthalamic nucleus is inhibited. Okay, so they will not now exert their excitatory effect on these GABAergic neurons, which means that they will not be excited. Means they are in a state of inhibition. When they are in a state of inhibition, they will not exert their inhibitory influence on thalamus. So there is overall excitatory output to the thalamus. Okay, overall excitatory output to the thalamus, and that's how the basal ganglia, they help the cortex in carrying out the smooth movements. Now see what happens when dopamine is not available. Okay, there is overall excitatory output to the thalamus. So the thalamus, it will send the excitatory signals to the cortex. Okay, so there is also the excitation of cortex. Excitation of the thalamus is also the excitation of the cortex, and that's how the movements are carried out. Okay, now let's see when dopamine is not available. So when dopamine is not available, dopamine will not exert its inhibitory influence. So these GABAergic neurons, they are no longer inhibited. Okay, dopamine was inhibiting these GABAergic neurons. Now these GABAergic neurons, they are not inhibited. They will send their inhibitory signals to these GABAergic neurons, the globus pallidus externus. Now they are inhibited. So when they are inhibited, they cannot send their inhibitory signals to the subthalamic nucleus. So there is now disinhibition. There is now disinhibition of subthalamic nucleus. So these glutaminergic neurons in the subthalamic nucleus, they will excite these GABAergic neurons, and there will be increased inhibitory output to the thalamus. Now the thalamus will be inhibited. Because of these GABAergic neurons, there is increased inhibitory output to the thalamus, and this increased inhibitory output to the thalamus is the main culprit in the Parkinson's disease. Now there will be experienced a difficulty in initiating movements, because the thalamus, when the thalamus is inhibited, it cannot excite the cortex or the thalamocorticospinal pathway, and there will be a difficulty in initiating movements. And similarly, we know that I already told you that this indirect pathway, it is an inhibitory pathway, and it prevents the undesired movements. And okay, so when this pathway is not functioning normally, and similarly the balance which was created by this dopamine, the balance was created between the excitatory and the inhibitory pathway by the dopamine, that balance is not disturbed. That balance is necessary for the smooth functioning of our muscles or smooth movements. When that balance is disturbed, we will observe the clinical manifestations of the Parkinson's disease, which include both hypokinetic and the hyperkinetic symptoms. Okay, you can learn the symptoms of Parkinson's disease from this mnemonic, that is TRAP: tremors, rigidity, akinesia, postural instability. Tremors the tremors and the rigidity, both of them, they are a hyperkinetic symptom, and the akinesia, it is a hypokinetic symptom. Okay, akinesia or bradykinesia. Akinesia means an inability to initiate movement, and bradykinesia means slow movements. This is a hypokinetic symptom, and tremors and rigidity, they are a hyperkinetic symptom. So the tremors, they are caused by the alternative contractions and relaxations of the agonist and the antagonist muscles. And rigidity is due to the hypertonicity of the muscles. This indirect pathway, okay, this indirect pathway, it decreases the tone of the muscles, but when it is not functioning normally, there will be hypertonicity of the muscles, which is called rigidity. And another symptom, this is our postural instability. It will also be experienced. In addition to this, the patients, they have an expressionless face. Okay, the other symptoms you can learn from the 4Ds. Okay, 4Ds of the Parkinson's disease, that is dysphagia, dysphonia, depression, dementia. Dysphagia, difficulty in swallowing; dysphonia, difficulty in speaking. Now you should remember that the tremor, okay, this tremor, it occurs during all the waking hours, and it disappears during the sleeping, and also when the person performs voluntary movements. When the voluntary movements are performed, this tremor, it disappears, and also during sleeping. And the rigidity or hypertonicity, it develops on the contralateral side of the body, and the akinesia or bradykinesia is due to difficulty in initiating movements. Now come towards the causes. So what are the causes of the Parkinson's disease? Okay, the main that main pathology is destruction or death of the dopaminergic neurons. So what causes that? It can be drug-induced. Drug-induced means that it is due to some drugs. The drugs our patient has been taking, such as phenothiazine group of drugs, or antihypertensive drugs such as Rezarben. It can also be due to viral infections of brain like encephalitis or cerebral arteriosclerosis, or it can be idiopathic, that is, the cause is not known, or due to injury to the basal ganglia. And one other thing you should remember, that Lewy bodies, okay, Lewy bodies, they are observed in the post-mortem reports of the patient whose death is caused by the Parkinson's disease. Now we exactly don't know what are the Lewy bodies, but they have been observed in the brain tissue of the patient who died from Parkinson's disease. Lastly, the treatment of the Parkinson's disease. First of all, L-Dopa. L-Dopa is administered to the patients with Parkinson's disease. The L-Dopa is converted to the dopamine. It's converted to the dopamine in the brain. Now the question arises, why the dopamine itself is not used? Because the dopamine, it has a molecular structure which cannot pass through the blood-brain barrier, and L-Dopa, it can pass through the blood-brain barrier. The other is L-Deprenyl. The L-Deprenyl, it inhibits the enzyme monoamine oxidase. Okay, this enzyme, it inhibits L-Deprenyl, it inhibits this enzyme monoamine oxidase. Okay, this enzyme, it causes the destruction of the dopamine in the brain. So if any dopamine is being produced in the Parkinson's disease, L-Deprenyl, it causes that dopamine to have long-lasting effects by slowing down its destruction. So a proper combination of L-Dopa and L-Deprenyl is used in the patients with Parkinson's disease. Finally, they can also be the other treatment is transplantation with fetal dopamine cells, but this treatment, it is not long lasting, it is short term. These cells, they cannot persist for long. And I think that's all. Thank you so much.